She told me the other day, she's like, I don't ever go on that table. I was like, yeah, that's for the big boys.
Yeah. Not old enough yet.
When you get to see watch that, I don't know if it's gonna pop, but you'll hear it.
All right. Go ahead and slide it for me. Go for it right there. How long you in for?
Until tomorrow.
Oh yeah, then you ship out, huh? Back to Texas?
Yeah. Yeah, back to, let's see, 30-degree highs and 10 and 20-degree lows at night.
It's supposed to be cold next week too here.
And then I'm working nights this week, so.
The panhandle, huh?
Yeah, well, sorta. It's
What
West
is that?
Texas. West Texas.
Stay flat. There you go.
It's West. It's just of the panhandle.
Windy out there.
Oh yeah, very.
All right, teeth and tongue in position. Nice smooth stretch. We're gonna keep it light. Easy, easy. Very good.
You heard that, Boo?
Good one. Give you a little more mustard.
Just
on
making
that
sure
one.
he didn't paralyze me, Boo. Something my knees jump.
Still kicking. Baby, baby. There you go.
A little bit of mobility.
How'd that feel, man?
Good.
Good, huh? Release that pressure.
You know how we were talking the other time, you were saying that when the body needs to crack, it cracks, you know, if you can make it crack it. This last week since I came in, everything's been subsiding.
Yeah.
Lessening. So it's starting to get back to where I was
Right.
a couple of months ago.
Again, that perceived need for proprioception.
Right.
Remember, that's what you give in your brain.
Yeah.
A dose of movement.
It depends on the movement. Now, with all the work I've been doing around the house, I've been having a painter. My buddy's about to do my floors besides my cabinet. Well, all the reaching and grabbing I've been doing, cleaning, whatever, my tennis elbow came back this last 2 weeks or week, whatever. And this weekend, it was starting to come up to here, and I never had that before. Because a couple of years ago, man, I had it bad, but I've never had it this bad. But I really hope it will work.
Yeah.
So I'll go back to work and where it don't work.
Yeah, it'll calm down a little bit.
It'll calm
You
down.
can always use ice and massage.
That's
kinda
what I've
tame
been
it down.
doing, like massaging it. Oh my God.
Yeah.
It once you hit the top of that, not the funny bone, right here.
Yeah, right there. That the lateral epicondyle, they call that, radial head. Yeah, there's a lot of interesting neuroscience on tendinopathy now. Tendons have a very small representation in the brain, so it's hard to treat. That's why they're so stubborn. And they've been traditionally called tendinitis. Well, then you do an MRI. Sometimes there's inflammation, sometimes there's not. Anytime you hear the suffix itis attached to something, it means inflammation of.
Right.
Well, then how do we explain the pain when there's no inflammation present? And that's been kind of tricky to explain it neuroscientifically. But what we've learned is tendons having a small representation in the brain, you have to really work that tendon to sort of teach the brain that there's really not a problem here.
Right.
The brain's just perceiving there to be a problem because the tendon did something it wasn't used to the tendon doing.
Right, exactly.
So the brain expands that model and understanding of the tendon. So you can do, that's why, giving yourself some ice, massage, whether it's vibration, deep pressure.
It's from overuse. I mean, all the time.
Well, yeah, in that case.
I used to grab things with my hand, 20, 30 pounds, and just walk with,
Right.
Right. Because, we used to have these chicks, and they were about 30 pounds, 40 pounds. You just pick them up and walk with them.
Yeah.
And it's just all the grabbing, because I feel it when I do this. It's hurting right here. But yesterday, I went to grab for my center console, but on the side, I have a little tray. I went to grab for the wallet. I was like, oh, can't do it.
Yeah.
I couldn't even pick my wallet up out the little slit. I was like, and then I went to get a box. This morning, I was taking some stuff out the cabinet, and I couldn't even get it out. I had to just do like this to get it to come out.
Pain said no.
Oh man.
All right, finish you up.